Hello, everyone. Welcome to our live stream today. We usually do this a little bit more during the week, but we decided to go ahead and do on Friday because we have a very special guest that has come into our campus today, and I wanted to introduce her to everybody and have a little chat with her today. So we're going to talk with Claire Hofstetter today. She is an alumna of ASIS. She did go to our Prescott campus. And just a couple years ago decided to come back to join us again on our staff and has been doing all sorts of things. She's a little Jill of all trades, if you will, and doing admissions, and she does a lot of our social media posts. So a lot of those really cool posts that you see are from her. And she's just got a lot of knowledge in a lot of different areas of the massage field. And so I invited her on to come and talk to us today about her experiences from both sides of the coin, being both part of the program and also seeing our new students go through the program and just having different jobs in the industry as well. So without further ado, let's say hi to Claire and welcome her. So
hi.
Audience. She has her hype team with her. That's awesome. I love it. Thanks for joining me today. And I'm glad you were able to take some time out today to chat because you are a busy woman all over the place, doing all your different jobs and things. So we'll get down to it. So I always ask everybody on this our little broadcast here, what got you into the field? What were some of the steps that got you into that? Or was it something you always thought about doing, a massage, or is it kind of something that progressed over time?
It's kind of, I guess, something maybe that progressed over time. So initially, way back in high school, I had wanted to get into a field that where I could help people that was short, like a shorter time commitment, not having to go to like a 4-year school and that sort of thing. So it was already sort of my thought process. And then I decided to go that 4-year path anyway. So it didn't quite work the way I wanted. And I ended up coming back into massage and really thinking like, wow, this is a field that I can, take with me wherever I go. All I need are my hands. And so I decided to, enroll and take that next step. So I was 20 years old and just, wanted to, I guess, just have that trade, have that sort of education that I could bring with me and get to help people. So
awesome. At that point, had you had many professional massages before in your life?
No, maybe 1 or 2. And so I think that's sort of what that initial start was. My mom had worked in a chiropractic clinic for on and off throughout most of my life. So, she was familiar with, getting body work, whether it being like a chiropractic adjustment or often, us massage therapists tend to work alongside them. So she had been getting body work, fairly regularly. And so she was the one who got me my first massage. I think it had to be 14 and I was weird and awkward and but I talked with the therapist and who I think she's still actively practicing today and just that kind of started to get the gears going, I guess.
Oh, awesome. That's so I went to massage school and never hadn't been on the table in my entire life. So people think that's really weird. And I'm like, well, I always gave massages. I just never had the feeling. Yeah. So yeah, it's interesting because I was learning to massage people, not necessarily how to get massages, but what a bonus that is, going to massage school and getting massages every day. Yeah, missed that a lot. Yeah. So tell us a little bit about your journey as you got licensed and some of the places that you worked. I know you've been in different sorts of parts of the field, and that's one of the great things about the field, that we do have a lot of options of where we want to work and we don't have to commit to one necessarily right away. What are some of your experiences?
Yeah. So right after school, I started immediately working in a chiropractic setting. So I worked, alongside a chiropractor, doing all kinds of different things. I wasn't actually doing massage just yet. So I was waiting for my license to come through still. But I still got to actively work with, patients and getting to work with therapies and get just an idea of sort of what that even looks like to treat somebody who's coming to you with specific problems or pain or condition. So that's where I started. And I stayed in that field for a long time. Obviously got my license and everything. So I was doing, more of the hands-on work. So working anywhere from, oh gosh, I'm trying to think of like some of the different tasks that I've done that are kind of alongside that. I worked in an office where I would develop x-rays and, even do the initial intake portion. I would verify insurance stuff too, or, maybe doing really specific, like, maybe 10 15-minute sessions with a patient, or showing them exercises, getting to do like some movement analysis stuff. As my like skills and training progressed, I got to do a lot more hands-on, where I was working more sort of like a physical therapy assistant kind of capacity. So I had a mentor and a doctor I worked with who was really willing to give me that education. So I got to, grow that. So getting introduced to cupping, like, geez, I think that was like 2015, and scraping techniques and kinesio tape and all those other different modalities that are sort of part of that wellness realm. So lots of like therapeutic work and, working with people with chronic pain or injuries, excuse me, and all kinds of things like that. So I really loved that, getting to see people regularly and getting to see, issues resolve, and getting to witness that. So sometimes as a therapist, you might see somebody once and you never see them again. Maybe they're just in town on vacation. Working in that capacity, and I got to see people consistently, and you get to learn their stories and learn about their goals and their grandkids or their marathon that they're running or whatever. And so it's fun to be kind of build that community sense, I guess.
Oh yeah, I love that. So did you stay there for a long time and then decide to explore other options?
Yeah, so I worked along, probably up until about 2018. I worked in chiropractic. So I completed school back in 2012. So it was about 6 years, I guess, working in more of a chiropractic clinical setting. And then that's actually about that time I was kind of being a workaholic and doing a little too much body work and just sort of reevaluating things. I had decided to finish my bachelor's degree through NAU and got my degree in public admin. And I just happened to find a job posting for ASIS and applied, and for some reason you guys hired me. So
we don't regret the day at all. We love that day.
So I thought that I could marry, my previous experience as a massage therapist with my, newly acquired administrative sort of skills, and then being able to give my own perspective for, prospective students coming in, and, just sort of like a well-rounded fit. So that was back in June 2018, I think, was when I started here. And so I've still been working, as a massage therapist, but more along where I can create my own practice or my own style, not necessarily dictated by treatment plans and stuff. I have a little more, what's the word I'm looking for? Autonomy, I guess. And do with people when they come and see me. Continued my education and that kind of stuff. So sort of shifted away from that clinical part where I still do that type of work, but not in that capacity anymore.
Right. So. Yeah. I love that you were able to get the massage and then go back to school and complete that. And so were you working while you were still getting your degree at NAU? Were you doing the massage as well?
Yes. Which I think that was part of my working, I was working in 2 different places, and then going back to school full-time, like an online accelerated program. So it was a lot of things. So when I was done with that, I was like, okay, like I need to switch and to change into something different. So that's what led me to transition out of doing all of those things.
Awesome. Yeah, I'm just gonna pause for a second and say a little shout out to Jimmy G, who said Claire rocks, and so does Michelle. We know what Claire does, and Shannon says hi too. So I wanted to say hi to those guys out there. Thanks for joining us on our live. Getting to talk to Claire here about her journey through the massage field. And so going to the school and then being on the other side of the coin and seeing the students come through the program, are there I was trying to think of like a 2-part question. So one, some of the classes that you liked, I know you kind of went towards like the injury rehab kind of Western side of massage, but I know, with the program, we have a lot of East meets West kind of things going on. Were some of the classes there that you really, really enjoyed? And at the same time, like when you see new students going through those classes, do you get like really excited for them about what they're going to learn? Or do you see like different aha moments of the same things that you kind of went through when you were in class too?
Yes.
So there's
Yes.
a lot of things to unpack. We didn't even pick some pieces of it there.
Yeah. So I'm trying to think. A lot of the different like modalities and things that I got to learn, through the program. I love like different pieces of it. So like connective tissue work, I thought was really, really interesting because I'd never been or had that like awareness of like what the heck fascia even was, before going into school. But I loved like doing like shiatsu work and Thai massage. Trying to think of some of the other things that we did in school now. It's been a while. So I did love that like Eastern aspect of things. And I see a lot of those like layers that still translate into, what I work with today. My career kind of took me more that Western one. So I'm trying to kind of get back over to the more of those, there's a whole other paradigm of just how the body works and how we view things that I think kind of gets overlooked sometimes working within the United States, especially. We're very Western. So it's important to bring that back in. So I'd like to continue at that as my, career continues to grow. So.
Yeah, I tell students all the time when they graduate here, they're going to know more about Western philosophy than Eastern philosophy more than I ever did, even though I've been in the field 20 years. It's just not something I did a track of. And I kind of say one of these days I'm going to sit in on our classes and take them with the students because I really want to learn them too. And just seeing the amazing aha moments I see a lot happen in those Eastern modalities for the students. I feel like not all of them they're like, I don't know what this is, because it's not something that's as talked about or as known about, I think, in some of the massage fields. We're thinking more of the Swedish stuff and the like deep, elbowy things and that kind of stuff. And so, they're coming into this unknownness of the Eastern modalities, and to see them come out of it was just like these huge, like proud moments and exciting moments. And I'm going to use this stuff, and to see how it can translate onto the table. And it's pretty cool to be able to see that. And to know that you don't have to do a full hour session of just that, but you can take pieces of it and translate it into your integrative work, and what we're really trying to encourage with our students. So have you talked to students about that before? Have they had those types of conversations with you?
Yeah, like the aha type moments or
Yeah.
So I remember it seems like there's usually like a handful of students that I encounter who have this, where they, complete a program and they're like, oh my gosh, like Thai massage was amazing. Like that's going to be, my path. And that's what I want to do. And then they take, I don't know, like the next, training, like craniosacral, and they're like, wait, never mind. Like, this is it. Like, this is amazing. And so as they continue to learn these new modalities, they get really excited about. They're like, what? Like, this is so cool. And so just to see that, or just to kind of, sometimes there might not be a modality that clicks right with the student. And then when they find their thing, they're like, this is it. Like, this is, I wasn't so sure about this other stuff, but like, this is really, what I'm drawn to and like what I want to, take and run with. So it's cool to see that. And especially like at the end of the program, just to see where everybody, like their different paths that they're wanting to take when they leave here. So I've talked about before, some people are really drawn to working, maybe with like prenatal, postpartum, pregnancy, infant massage, like that world is very, near and dear to them. And so that's where they gravitate towards, or working in more like oncology, or like clinical, like medical massage, post-op, or like burn survivors, things like that. So it's cool to see like all the different like niches that one can get excited about and drawn to, and just there's so many different paths that everybody can take. So it's cool to see those little like maybe I should go and do this, or integrate that into a practice. So
Absolutely. Which reminds me that, so you just recently decided to explore a little further of some of the lymphatic training. I'll get to that particular thing in a second, but we have students a lot of times who say, I'm not ready. Please don't make me leave. I don't know everything yet. Like, we don't expect you to know everything yet. You're only spending, 6 to 12 months, depending on, what your program length is. You're only spending that little time with us, and there's a huge world out there to still explore. So if you found, Thai is your thing, there's advanced classes out there. There's trips to Thailand that you could go and learn in actual, in a Thai setting and that kind of thing. thing. And so I love that there's the continuing education. A little shout out to Jimmy G, who's hopefully still watching there, who does a lot of great continuing education classes out there that, you know, they can explore further. And you can take little snippets of them, like a little weekend, a couple hours, that kind of thing, or do something like what you did. And you want to talk about that a little bit of what you pursued?
Sure. Yeah. So I most of my career, like I shared, has been more in that clinical, like therapeutic, injury rehabby, very Western sort of model. And I recently was I knew about this workshop for a while, and it took me a while to finally commit to it. So it's I recently was certified in manual lymphatic drainage in the Vater technique.
Mm-hmm.
And it's very, very different than anything like I've ever done. I think one of my partners in class said, wow, Claire has never touched anybody gently ever in her life. So, lymphatic work is, very delicate, very, not delicate, but it's a light touch. Your intention is substantially different than if I'm trying to, get some, like a trap, to release something. Trigger point. So it was really interesting to shift my perspective there. And then the amount of knowledge that I learned, it was a 6-day, intensive, like 40+ hour training, where I was just like, oh my gosh, like, what have I been doing all these years? I've just been smashing these little lymph vessels. And I feel like, we talked about it in school, but it was never emphasized as much. So I was like, wow, this is a really important system. And it is often neglected, or anyway, I just like, the more that I find that I learn, the more I realize, like, I don't know. So I'm constantly just like, am I ever going to catch up there? Like, probably not, which is, I think, a good place to be always, willing to learn and be educated and to process all of that. So just kind of funny where I was like, what? It's so much knowledge. So
all the classes.
Yeah.
So much to take in. Yeah. That it is a little side effect of education, is realizing there's so much more to still go learn and be out there.
Yeah. It becomes like an addictive, not addictive, like that sounds negative, but always wanting to like do all these, continuing classes or learn more, or maybe even, I guess, like a good advice is maybe take something that you're kind of unsure of, or maybe you have not much knowledge about. Cause I really didn't before I took the class. And then after the training, I was like, wow, like this is really, important or powerful. So I think it's fun to try to jump out of your comfort zone a little bit and try something new. Most of my continuing education prior to that was, just furthering like myofascial release stuff, or, different connective tissue fascial workshops and, things like that. So very different. And
yeah, absolutely. Yeah, we have our next mod on our campuses for the full-time class. Lymphatic drainage is going to be one of the classes, and we tell them it's 3 day. We do a part of it is on the online with the hybrid for the lecture, but then they have 3 days hands-on. And you're talking about 6 day intensives. I always say, we're just teaching you some very basics about this, and if it's something you want to really explore, there's definitely a lot of courses out there. One being our sister school, ACLS, out of Florida, that they travel around a lot. They have a lot of different certification classes as well too. Yeah. So there's lots of things out there. People I know, would do shiatsu, or one I could think of there. Shiatsu there's schools that have 2 years of shiatsu training, and then you still intern and all this stuff. And we're giving you 12 classes or 13 classes on them. So
like just
there's only so much that you can do, for sure. But we just want to give you little pieces to get you, kind of get your feet wet, and then explore what kind of feels good for you and what you want to explore more. So, but I love those moments. People are like, I'm not going to like this class. And then they're like, that's it. That's my jam. That's what I'm going to do. So that's why I love, we had a recent graduate, Crystal. I'll see, maybe someday I'll get her interviewing on here because she's hilarious. But we did a prenatal massage, and I had everyone practice the sideline, just gentle, not even gentle. It's not like we're having kid gloves on, but, it's more of a relaxation focused massage. And, at the end of the class, everyone was like in this like foggy, like land, because they were all like, oh, that was the best. And she comes over and she says, you know what, Michelle, deep tissue is trash. A sideline, relaxing prenatal all the way is what I'm doing.
Yes.
It's so funny. We're just always trying to get in there sometimes taking a step back and letting someone relax completely, and just kind of be is really a lovely gift too. So
yeah,
I love that. So talking a little bit also about your admissions duties and how you've enrolled a lot of our students in the program. Do you have any like I know we were just talking about that. Is there a typical student? And we kind of laughed about that. Like, gosh, I don't even know. We can't even pinpoint that. But, are there some common traits among the students who enter the program, and the ones that are really successful and really take a knack to this learning? Have you noticed some things about them? What interests them? Why they're getting involved, or what they're looking to pursue or fulfill in their life? Any traits like that pop out to you?
Yeah. What I think one of the biggest common things that I see is that most students they've experienced something in their life where either like massage, like a different perspective, or more of a holistic aspect, or wellness, or just like a shift in sort of our kind of modern medicine, something like that has like led them towards this path. So maybe it's their own, healing journey. Maybe they had, like I know we had alumni who was previously, he was paralyzed, right? And, went through all this rehab. And that was one of the sort of aha moments, was some of the techniques that they did during his, rehabilitation, he would do on himself, and realize like how beneficial it was, and how it helped him to, be able to regain his mobility, and to, walk and actually, continue through a massage therapy program later in his life. So I feel like there's a lot of those sort of things, or maybe somebody's, mother had something going on, and something was very beneficial for them, or they just sort of see like that power of human touch, whether it's the aggressive elbow, or even more gentle sort of care. So or even just sort of seeing that again, kind of that modern medicine isn't quite working, or doesn't quite align with their like core values. So they're looking to, find something that they're passionate about, something that they can get, behind, and just sort of say like, I think we can do things a little bit differently.
Yeah.
That tends to be. So whether they're, 18 and fresh out of high school, or they're, 60 plus years old and looking to, start over like career number 3. Because we've had all kinds of different people in between, but that seems to be sort of that common thread, is there's some sort of, there's some sort of positive experience that they've had, or someone in their life has had, that's, transformed their like perspective on how we help people, how we treat people, and get that. So.
Yeah. Do you notice the more not fresh out of high school students maybe concerned about being able to keep up in the field and the physical demand of it, and have you seen them, either express those feelings, and at the same time, what has been the outcome for some of the students who pursued it and decided to go for it? Were they able to keep up and do all the work and be able to finish program?
It's definitely a good question. Yeah, I think a lot of them have that sort of fear that, oh my gosh, I'm going to be the oldest person in the class, and it's going to be so strange. And 9 times out of 10, that is not the case. And I think just the way that we approach learning here too, it's so much different. Like there is an aspect of technology, but there's also there's different things everybody sort of brings to the table. So it becomes somebody is struggling maybe with figuring out how to access the online learning portals or whatever. There's that that's here to help support it, and kind of vice versa. So maybe somebody is struggling with like communication or writing skills or something like that. Maybe somebody was a previous, administrative like executive in another life, and so they can bring that to the table. So I find that helps out as far as like the education goes. And then as far as physical demands and that sort of thing, it just is 100% on like your body mechanics, which gets pounded in Swedish. So work smarter, not harder. And it depends on what kind of path. So a lot of, self-preservation, taking care of yourself first before you can take care of others. So really creating those boundaries, not everybody needs to be a deep tissue crazy therapist. There's plenty of them out there, right? So really finding a path that they feel comfortable with, and knowing how to set like those own personal boundaries. So if they're uncomfortable doing really aggressive, physically demanding work, you don't need to do it to be a successful massage therapist. Right. So kind of touching back on that lymphatic training that I just did. The instructor has been a manual lymphatic drainage therapist for 20 plus years. And if somebody wants something aggressive, she just refers them away. She's like, there's somebody else who's out there to take care of you. This is what, my passion is. So you can really just kind of, figure out what your niche is. And I find too that even like the older students, they've often have gone down a career path before, or they have found out exactly what they do not want to do. So they even have more of a clear direction than somebody who might be, straight out of high school. They know that they don't want to, continue doing what they're doing, or, they have a better, I don't know what I'm trying to say. Not necessarily better, but often they can have more of a clear direction of where they want to go. They've already been where they don't.
Right.
So they can really, overcome any obstacles that they might foresee or might have, and can get there. So
yeah, I love seeing those students who are like, I can actually do this. Like, it's even the physical obstacles that some of them have, and then they realize, okay, it's about body mechanics, it's about leverage, it's about using your strengths and using it to your advantage and not trying to work harder, like you said, but also like the more of the other blocks that people have. I wasn't a great student when I was in high school, or just barely squeaked by, and seeing those like, wait a minute, I actually am smart and I know how to do things. And it's like, yeah, because now you're interested in this and it's important, and we're going to work with you to make sure that you're going to get the information. So, and then you're actually physically working with it, so you get that kinesthetic part of it as well. So I love when we have those moments of those students like, oh, I didn't realize like I could be good at school. Like, it's pretty amazing.
My favorite thing too is when we have classes that start together and we have so many different people from such very different backgrounds. We're like, how we're just like, how are they going to get together? So it was a class they've graduated way back, last year sometime, or previous year even. But, a student who was like in her 50s, she'd never gone to any school before. She's in the class, and we have somebody who has like their master's degree in kinesiology, and then like a fresh 18-year-old kid, right out of high school, and they're all together working very closely with each other. I'm like, are they going to get along? They're one of the most closest tight-knit groups that like help their little like weaknesses. And
I remember that graduation. We're like, how did that work? We all said, how is it going to work? And somehow and it was amazing. It was like one of the most beautiful things that we saw. It was great. It was wonderful to see them grow together.
Never have a conversation in a coffee shop together, and then you're like, oh my god, look at them being like besties by the time that they leave.
Yeah, so. I know, it's so fun. I love seeing that. I love seeing that little family and that bond that they get to develop, and then again they're like, please don't make us leave. So yeah, I know. We always tell them we always have a home here. That's why some our alumni can always come back and sit in on classes, and and get to keep visiting us and tell us how they're doing. We always want to see them too. So I do love those moments when they come and they bring their kids that we saw when they were babies and all that. Yeah, so great, so wonderful. So thank you so much, Claire. I want to I know that taking precious time out of your day today and being able to talk to us and share some of your experiences, both sides of the coin here at ASIS, a very unique perspective that you have. I really appreciate you sharing that with us. And I know if you call into the school and want to ask more questions from Claire, more of a different perspective for her being in both parts, I know she'd be happy to answer some of those and some of the emails. And she does help with some of the admissions as well, and some of those questions as well too. So, but just as a reminder, if people want to get in on the next classes, we have a January 25th, I think, it is our next full-time start, and our next part-time start is February 6th. So they're coming up right around the corner here, and we're going to have some good classes forming here, so you can be in that random group of people all over the place. They're going to be best friends forever.
So, friends and strangers.
Yes, exactly. Come as strangers, leave as friends, right?
Yes, there we go. Exactly.
Yes, absolutely. All right, Miss Claire. Well, thanks so much. Thanks everyone for joining and those catching us after the live. We'll see you hopefully next week with some more great content, and look forward to seeing that. Keep your eye on our Facebook and our YouTube to find out when the next one's going to be. Thanks, everyone.